I am Alvin Glassgold, founder of the Glassgold Group. Rhinoplasty is my passion. Many years of experience and thousands of rhinoplasties have taught me the many nuances and complexities of this operation. In striving for a successful outcome, which means a well-satisfied patient, we must listen to the patient's goals, evaluate the nasal structure, and establish an appropriate game plan. Our objective is to create a nose which appears aesthetically well-balanced and appropriate for each individual patient's face. In order to accomplish this, we must consider the following. The female should have a more feminine nose, as we see here. The male requires a stronger, more masculine nose. We must consider ethnicity. The typical Caucasian nose requires hump removal and reduction in size. The African American or black patient usually requires significant nasal narrowing and frequently a building up the nasal bridge. This is also true when we consider rhinoplasty in the Asian patient, as we can see in this individual. Our approach to rhinoplasty has evolved over the years, and we now utilize an open structure technique which allows us to make more precise change and have much more predictable outcome. It has eliminated the use of nasal packing and results in a more pleasant and briefer recovery time. I'd like to indicate some of the salient features we address in rhinoplasty. First, we'll talk about the profile. Most commonly, we are reducing an over-projecting nose, removing a bump at the bridge, as well as reducing overall nasal size. In addition, the following are changes that we must be able to accomplish in rhinoplasty. Reduction of the over-projecting tip, as we can see in this individual. Also, shortening the long nose, which droops over the lip. This is an important consideration. We also want to be able to elevate a drooping tip, as we see in this young man. And when the nose is overly long, we want to be able to shorten it to an appropriate size. Tip contouring can vary from a well-defined tip, as we see here, which some female patients prefer, to a more subtle tip, as we see in this young lady. The male nose generally requires a subtle tip. The decision as to which type we do depends on the patient's nasal structure, skin type, and desire. And this is determined at the time of consultation. Now we should look at the frontal view. And in most cases, the frontal view changes are very subtle and natural, making the effective rhinoplasty not too noticeable. Narrowing the very wide nose is important. A tip which droops with a smile must be corrected and fixed and secured so it maintains proper position even when smiling. Crooked noses must be straightened so that they don't detract from the facial appearance. We also pay particular attention to the nostrils. We want to make sure that they are appropriately sized and contoured. When we analyze the profile, the relationship of the chin to the nose can be very important. A receding chin will make the nose look more projecting, and in some cases, as we see here, we've recommended an augmentation of the chin, which is called a mentoplasty. And this would be performed at the time of rhinoplasty. These are just some of the important aspects of rhinoplasty. Each patient is treated individually. If you're considering rhinoplasty or are unhappy with your nasal appearance, I strongly recommend you seek a consultation so we can evaluate your particular situation and make appropriate recommendations. During this consultation, we often will use computer imaging as an aid. Lastly, we don't want to lose sight of the importance of nasal function, which is always addressed at the time of rhinoplasty. For more information, please visit our website at www.glassgoldgroup.com. Thank you for your attention.